Okay guys, let's continue. So we have discussed about the Wegener Granulomatosis. Here one important point which I want to add is, see, this Wegener Granulomatosis is having a triad of symptoms. The patient is going to have a Wegener triad. So what is this Wegener triad? So the patient is going to have, yes, vasculitis is going to be there. Yeah, no doubt the patient is having the vasculitis. Okay. Second one, the patient is going to have the LRTI, that's the lower respiratory tract infections and the upper respiratory tract infections, and the glomerulonephritis. The patient is going to have the glomerulonephritis, which means the lung involvement is there, the kidney involvement is there. Okay, vasculitis, lung involvement, kidney involvement. So all these three together are called as the Wegener's triad. And one more point which I want you to know is this Wegener's granulomatosis. Patient is going to have a C-ANCA positivity. I have taught you 75% of the patients, see, 75% of the patients in the labs you will find C-ANCA positivity. See, the C-ANCA, what exactly is the C-ANCA? Cytoplasmic ANCA, right? These antibodies, see, these antibodies are produced against what? See, these antibodies are produced against the proteinase 3. Okay, so these are the antibodies which are produced against the proteinase 3. So C-ANCA antibodies are produced against proteinase 3. Then if you ask me P-ANCA antibodies, see P-ANCA, okay, P-ANCA antibodies, they are produced against what? They are produced against the myeloperoxidase. Okay, they are produced against the myeloperoxidase. So P-ANCA are the antibodies which are produced against the myeloperoxidase. C-ANCA antibodies are the antibodies which are produced against the proteinase 3. Proteinase 3. And what is the treatment of this Wegener granulomatosis? Here some importance is that, that's why I am just teaching you. So cyclophosphamide is a drug, cyclophosphamide, ifosfamide, these are the drugs which are used in the treatment of this Wegener granulomatosis. But when you take the cyclophosphamide side effect is hemorrhagic cystitis. Okay, inflammation of the urinary bladder, hemorrhagic cystitis. Why? Why? Because whenever you take the cyclophosphamide or ifosfamide, these molecules in the body, they are metabolized into a substance called as acrolein. Okay. So the cyclophosphamide in the body is going to be converted into a substance called as acrolein. This acrolein, it will irritate the bladder. It will cause inflammation of the bladder and it will cause the bleeding of the bladder, which is going to cause the hemorrhagic cystitis. Hemorrhagic means the bloody. The blood is coming out in the urine and there is inflammation of the bladder. And the inflammation of bladder is because of the acrolein. Acrolein is a metabolite of cyclophosphamide. And cyclophosphamide is used for the treatment of Wegener granulomatosis. Okay. So having said that, now let's continue with the other type of vasculitis, which is also called as a microscopic polyangiitis. This microscopic polyangiitis is also called as leukocytoclastic vasculitis. Okay, leukocytoclastic vasculitis. Same. This is also called as microscopic PAN. Microscopic polyangiitis is also called as microscopic polyarthritis nodosa. We have studied about the polyarthritis nodosa, PAN, polyarthritis nodosa. It is a medium vessel vasculitis. This microscopic polyangiitis, which is a small vessel vasculitis, it is also called as a microscopic PAN. Why we are comparing it with microscopic, why we are comparing it with polyarthritis nodosa, why we are taking the word PAN here? Let me tell you some important similarities and differences. Now, polyarthritis nodosa, let's write polyarthritis nodosa over here. Now, let's write microscopic PAN here. Okay. Microscopic polyarthritis nodosa. See, PAN is a medium vessel vasculitis. Okay, but microscopic polyangiitis, it's small vessel vasculitis. Okay, it's a small vessel vasculitis. In polyarthritis nodosa, the ANCA is not there. Okay, ANCA positivity is not there. So P-ANCA is going to be negative. But this microscopic polyangiitis is a condition where the P-ANCA is positive. Okay, P-ANCA is going to be positive. And remember, both this condition, polyarthritis nodosa as well as the microscopic PAN, they are, now I am talking about the similarities. Both of them are examples of fibrinoid necrosis. So on microscopic, if you look at the microscopic polyangiitis, microscopy will show fibrinoid necrosis. Okay, fibrinoid necrosis, and here you won't see any granulomas, non-granulomatous. And nuclear fragmentation can be seen. Okay, the nuclei is going to be fragmented. Nuclear fragmentation. Okay, nuclear fragmentation. See, remember the similarities is both the polyarteritis nodosa as well as the microscopic pan. Both these conditions, they are example of non-granulomatous conditions. Polyarteritis nodosa as well as the microscopic pan, both are non-granulomatous. Both are examples of fibrinoid necrosis. Okay. Now, which organs are going to be affected? So in Wegener's granulomatosis, 3 organs are going to be affected. The nose, lungs, kidney involvement is going to be seen. Okay. Now in this condition, lungs are going to be affected, kidneys are going to be affected. Because of the lung involvement, there is hemoptysis. Because of the kidney involvement, there is hematuria. So even in this microscopic polyangiitis or microscopic pan, the patient is going to have hemoptysis as well as hematuria. Okay, hemoptysis and hematuria are there. Even in Wegener's granulomatosis, hemoptysis and hematuria is seen. Even in Goodpasture syndrome, hemoptysis and hematuria are seen. But how to differentiate microscopic polyangiitis with Wegener's? Wegener's C, it is C ANCA positive. But this microscopic polyangiitis is P ANCA positive. Let me write here. Wegener's versus microscopic polyangiitis. See, Wegener's, it is C ANCA positive. Okay, microscopic polyangiitis is mainly P ANCA positive. Okay, and not only that, Wegener's, the patient is going to have granulomatous inflammation. So granulomas are present, but microscopic polyangiitis, no granulomas. Okay, and Wegener's have its own associations like saddle nose, strawberry gingivitis is going to be seen. Okay, it have its own things. Hemoptysis, hematuria is going to be seen, runny nose is going to be seen, otitis media is going to be seen. If you have all this, then it is Wegener's granulomatosis. But microscopic polyangiitis also presents with. Microscopic polyangiitis also present with hemoptysis and hematuria, but how to differentiate microscopic polyangiitis with Wegener's? Wegener's is a C ANCA positive, but microscopic polyangiitis is P ANCA positive. One is granulomatous inflammation, the other is non-granulomatous inflammation. These are the important points which I want you to know. Now, after this microscopic polyangiitis, now let's discuss about the other type of small vessel vasculitis called as Henoch-Schönlein Purpura. It's also a type of small vessel vasculitis which I haven't discussed over there, but it is also small vessel vasculitis. See, it is the most common, okay, vasculitis in children. Okay, the most common vasculitis in the children. The most common vasculitis in the adults, it is a temporal arteritis. Okay, in the temporal arteritis is the most common vasculitis. And in children, if they ask you, it is the Henoch-Schönlein Purpura. It is also called as anaphylactoid. Okay, anaphylaxis because of some kind of allergy. Anaphylactoid purpura. Okay, anaphylactoid purpura. Now, why this is happening? This is because of IgA immune complex deposition, IgA deposition. Okay, this is because of the IgA deposition in small vessels. Okay, so this is IgA vasculitis. So imagine there is a small kid. Now this kid got some infection. Because of the infection, the baby is producing too much excessive amount of abnormal IgA antibodies. These abnormal IgA antibodies are getting deposited in the vessels, walls, and that's leading to the inflammation. So this is IgA mediated. Okay, IgA mediated vasculitis. Okay, so this vasculitis is IgA antibody mediated vasculitis. So what are the clinical features in these patients? The clinical features are just like HSP, Henoch-Schönlein Purpura. So what is this Henoch-Schönlein Purpura? H stands for hinge pain. That is joint pains or arthralgias. So if a baby is having Henoch-Schönlein Purpura, yes, it's not only just the vasculitis. So the baby is also going to have hinge pain or the arthralgias. S for stomach pain. This stomach pain is because of intussusception. Okay, intussusception is the telescoping of the one part of the intestine into the other part. Okay, that's going to be present. And P for palpable purpura. Okay, palpable purpura, especially on the buttocks. Okay, see this purpura means bleeding, right? This purpura is not because of the less platelets. Usually whenever the platelet count is going down, whenever there is thrombocytopenia, that will lead to bleeding, that will lead to purpura. But an important point which I want you to know is this is not associated, these purpuras, okay, these purpuras especially on the buttocks, these are the palpable, okay, these are little elevated, they are not associated with platelet count. They are associated with, okay, what? They are associated with the IgA complex antibodies. Okay, they are associated with the IgA complex antibodies leading to vasculitis, inflammation of the blood vessels leading to the purpura. So the purpura is not because of the thrombocytopenia. Here the purpura is because of the vasculitis. Okay, IgA vasculitis. Now, in Henoch-Schönlein Purpura, which blood vessels are going to be affected? In Henoch-Schönlein Purpura, let me write somewhere over here. In 30% of the cases, the renal blood vessels, okay, renal arteries are going to be affected. That's the association. Renal arteries are going to be affected. Now, in the lab diagnosis, in the labs, what you will see? The platelet count, there is thrombocytosis. It's not the thrombocytopenia, even the platelets, because of this bleeding, more and more platelets are getting produced. There is no problem with the platelets. The bone marrow is healthy. The patient is losing all this blood, right? Because of that, more and more platelets are being synthesized. So there is thrombocytosis is seen. Not only that, all this problem is because of what? Because of the IgA antibodies. So there will be elevated IgA antibodies. Okay, elevated IgA antibody levels in the serum. So what are the important points about the Henoch-Schönlein Purpura? It's the most common vasculitis in the children associated with the IgA antibodies. Some infection is there. Because of that infection, more and more IgA antibodies are getting produced. These IgA antibody complexes, they are going to be deposited in the blood vessel leading to the vasculitis. Which arteries are going to be involved? Mainly the renal arteries are going to be involved. Now this patient with the Henoch-Schönlein Purpura, these patients are going to have a clinical features of HSP, Henoch-Schönlein Purpura. H stands for the joint involvements can be there. There can be stomach pain. Why? Because this Henoch-Schönlein Purpura is something associated with the intussusception, the telescoping of one part of intestine into the other part of intestine. And P stands for the palpable purpura. And this purpura are not associated, not at all they are associated with the thrombocytopenia. They are associated with the IgA complexes. Now, after this, let's discuss about the Churg-Strauss syndrome. See, this Churg-Strauss syndrome is also called as allergic granulomatosis with polyangiitis. Allergic. See, this is an allergic vasculitis. This Churg-Strauss syndrome is a condition which is an allergic vasculitis. Now, what are the clinical features which are going to be seen in this condition? See, it's allergy, right? So, which blood cells are going to be associated with the allergy? It's the eosinophils. So, the patient is going to have eosinophilia. Okay, the patient is going to have the eosinophilia, and other allergic conditions which are going to be seen in these patients are allergic asthma, okay, allergic asthma, and allergic rhinitis can be seen. Okay, allergic rhinitis can be seen. So, not only the small vessel vasculitis, yes, because of this eosinophilic deposition, eosinophilic infiltration into the blood vessels. Yeah, there is small vessel vasculitis, but not only the small vessel vasculitis, this condition is associated with some other allergies also, like eosinophilia, eosinophilia leading to the allergic asthma and allergic rhinitis. See, these eosinophilic infiltrates, they are also going to infiltrate into the heart, and that lead to the congestive heart failure. That's the most common cause of death. In this, so now tell me, Churg-Strauss syndrome. Churg-Strauss syndrome is a allergic vasculitis. It is also called as allergic granulomatosis with polyangiitis. Granulomatosis is there, so definitely it's a granulomatous inflammation. See, in this condition, excessive eosinophils are going to be there. These eosinophils are going to go into the lungs and causes allergic asthma. It causes allergic rhinitis. These eosinophils, they will go and also deposit in the heart, leading to infiltrative, like infiltrative cardiomyopathies leading to congestive heart failure. That's the most common cause of the death. So with this, Churg-Strauss syndrome is also completed. Now, just have a summary of different types of vasculitis. Now we have discussed about the large vessel vasculitis. What are the two important large vessel vasculitis? Already we have discussed giant vessel vasculitis as well as the Takayasu arteritis. Important points about the giant vessel vasculitis: elderly, seen in the elderly age group, females after 50 years. Okay, temporal artery biopsy need to be done. Optimal length is going to be how much? 3 to 5 centimeters. Granulomatous inflammation is going to be there. Okay, there is a risk of blindness. Immediately give the steroids. So all these points we have discussed. So look here, done. So Takayasu arteritis. Takayasu arteritis is a pulseless disease. Aortic arch is going to be affected. The weaker pulse in the upper extremities and the pulse is going to be normal in the lower extremities. Okay, pulseless disease, Takayasu arteritis, going to be seen in females less than 40 years of age, aortic arch syndrome or pulseless disease. Done. After that, the medium vessel vasculitis. What are the examples of medium vessel vasculitis? Polyarteritis nodosa, plan B. Remember, plan B. So what are the points which I want you to know regarding the plan B? Associated with the hepatitis B, associated with the hairy cell leukemia, pulmonary arteries are not affected. Okay, so these are the points. Next, see, they are seen in the young adults. Yes, it's a widespread. Polyarteritis, multiple arteries are going to be affected. And Kawasaki disease, children less than 4 years of age, coronary arteries are going to be affected. There is a risk of myocardial infarction. Diagnosis, CRASH, conjunctivitis, R for rash, S for CRS, conjunctivitis, rash is going to be seen, and strawberry tongue is going to be seen. CRASH for hand and foot involvement is going to be seen. Okay, A for adenopathy. And Kawasaki disease is going to be seen in children less than 4 years of age, coronary arteries are going to be affected, and multiple lymph nodes are also going to be affected, and myocardial infarction can be seen. And Burgers, there is a small typing mistake here, it's not burgers, it's a Burgers. Okay, it's a Burger disease. Let me just... Okay, so Burgers disease. See, this Burgers disease, yes, it is seen in smokers, heavy smokers associated with the Raynaud's phenomena. Okay, don't forget, associated with the heavy smoking and Raynaud's phenomena, there will be auto amputation of the fingers. The entire neurovascular bundle will be affected. Don't forget about that. Okay, now small vessel vasculitis, what we have discussed? Small vessel vasculitis, Wegener Granulomatosis, remember it as Wegener's. C-ANCA positivity is going to be seen. Strawberry gingivitis, strawberry gums are going to be seen. Saddle nose is going to be seen. Nose, lungs and kidneys are going to be affected. Perforation of the nasal septum can be seen. Hemoptysis and hematuria can be seen. Otitis media can also be seen. That's the Wegener's granulomatosis. Okay, Wegener's granulomatosis is granulomatous inflammation. Granulomatous inflammation. And Churg-Strauss disease. Okay, Churg-Strauss syndrome. Lungs are going to be affected. Kidneys are going to be affected. Churg-Strauss syndrome is the eosinophilic vasculitis. Eosinophilia will be there, asthma will be there, rhinitis will be there. Eosinophilic infiltrates goes into the heart and causes the and causes the congestive heart failure. Okay, so Churg-Strauss disease, yes, P-ANCA positivity, Churg-Strauss. And last one, microscopic polyangiitis. Microscopic polyangiitis is also called as a microscopic pan, which is P-ANCA positive. Okay, P-ANCA positive, and lungs and kidneys are going to be affected. So with this, we have completed all the topics of the vasculitis. So small vessel, medium vessel as well as the large vessel vasculitis, all the important points are completed. So with this, the topic of vasculitis is completed. Now let's continue in the next video with the topic of vascular tumors. Okay, thank you.